Guys, this is Ohio nursing home abuse lawyer Will Eadie, and I'm stopping by as an episode of our Healthy in a Nursing Home series to talk about one secret to boosting brain function for nursing home residents that I think is often overlooked, and that's exercise. The connection between physical fitness, including weights, weightlifting, getting up and about, those kinds of things, and brain function. The studies are out there. It's an incredible impact. So I was just listening to a great podcast episode with Jim Quick, Kwik. He was interviewing Sean Stevenson, who is a health guru, health expert, has a great podcast of his own on what exactly are 4 easy exercises you can work into your lifestyle to boost brain function. And as I listened to it, and I thought, yeah, I ought to be doing that, right? I also thought, this is exactly what we could be doing with nursing home residents. It's what happens when folks are in physical therapy. So I really highly recommend, if you can get an order for physical therapy, go for it. But even if not, there are ways to work all of 4 of these into a nursing home resident's lifestyle to help get the blood flow going and rejuvenate, restore, or help prevent further deterioration of brain function if at all possible. And we know that's a huge part of the decline that can occur in a nursing home setting. So here are the 4 pieces of exercise or types of exercise that Sean Stevenson recommended. Number 1 is strength training. And Sean makes a great point. This doesn't have to be heavy weights. You can start with body weight. You can start with leaning against something and doing incline push-ups, or light weights like they have in a therapy department, Therax bands, those kinds of light weights, whether you're sitting in a wheelchair, whether you're up and about, getting the weight training going a couple times a week. Number 2, movement and agility exercises. Now, Sean talks about this as speed and agility. Speed is not something I necessarily think you should introduce in a nursing home setting, but certainly movement and agility are key issues. And this relates to a very specific sense we have. You know about our 5 senses. There's a number of other ones, but one of them is the sense of your body in space and moving about space. And practicing moving around can really help with maintaining that sense, which really helps prevent falls. So that's so important. Number 3 is walking. Seems simple, seems obvious, but it's what we're designed to do as people. It's what our body's designed to do. So whether someone needs assistance, needs help preventing falls, needs physical assistance getting up, or needs the bars to work with, whatever their particular needs are, if possible, getting them up and on their feet and moving around every day if possible is really helpful. And then number 4, high intensity interval training. Now this sounds like something that you couldn't do as a nursing home resident necessarily, depending on your physical ability, but there are options out there. So if you can't get on an exercise bike, exercycle, and pump for a certain amount of time, there are hand crank bikes that you can use. There's other ways to try to work in interval training. So my recommendation to you, if you have a loved one in a nursing home setting or assisted living setting, is number 1, try to get an order for therapy. If you've seen any kind of decline, if you have any kind of physical ailment, see if a primary care doc will write an order for therapy, because therapists are great at knowing how to do these exercises, teaching you how to do these exercises, and how to help your loved one with these exercises. So that's a great first step. If you're not able to do that, or if that's already been completed and you can't get another order, go help them get to these exercise classes many nursing homes are putting on, or get the equipment yourself, or if you can get use of the therapy gym, whatever you need to do to help these folks get up and get moving in whatever ways they're able to do safely can be so important. That body health, brain connection is something you don't want to overlook. So I hope this helps. I hope it's another way that you can help a loved one stay healthy in a nursing home. If you have any ideas or suggestions, please leave a comment, like, and share. And I'll put some links to Jim Quick's podcast and Sean Stevenson's podcast in the description or comments. Thanks, guys.